I went to sleep on the night of November 11th and I was a bit tired. I know that I put my daughter to bed, and the hard thing is I don't remember saying goodnight to her. Woke up at about 3:45 in the morning with a terrible headache, and I collapsed. They took me to the hospital and they said to my husband, "I'm so sorry, but your wife has had a catastrophic brain hemorrhage and she's not gonna make it. You need to start making some phone calls." When they were prepping me for surgery, the doctor said in front of me that I had a 1% chance of survival. And even if I did survive, I was going to be in the hospital for 6 months learning how to walk and talk. And there was an amazing surgeon who was just wonderful and said, "I'm confident that I got all the blood out of there." After the surgery and that, I just got better and better. And the nurses were great with me. They pushed me, but in a way that was exactly what I needed. So I was up and I was walking. And about 3.5 weeks later, the doctor that was working in the hospital, he said, "You can go home because there's nothing medically that we can do for you here."
The role of chemistry in her early care when she was in the intensive care unit, watching how her brain was reacting to her devastating injury, managing her fluids and her electrolytes while she couldn't eat or drink, that's pivotal to making sure that her brain is recovering in a stable environment.
I spent so much time unconscious and was unable to speak to anybody and tell them what I needed. But in the background, they were running all these tests constantly.
By having quick lab results so that we can treat any ones that are abnormal and ensure that she had the best chance of a meaningful recovery, which amazingly, and she did, and that she's back to being her normal self, which is incredible.
I'm the executive director of HR support with the province. I've been back for full-time for over a month, and it's just a miracle how this has all happened.
The lab is often a forgotten part of healthcare, especially diagnostics. We always seem to be in a corner somewhere, but we pride ourselves in getting results out to physicians so they can make their best decisions.
If you imagine yourself as a patient, everybody knows that every time you get admitted to hospital, you get blood work done. It turns out the chemistry, which is the measurement of your salts, your sugars, and the essential elements in your blood, is the most commonly performed test. We do millions of those tests every year here in Island Health.
Chemistry line is absolutely crucial for what we do on a day-to-day, honestly minute-to-minute basis. And as we all know, we suffer from significant wait times where our patients wait for these results to come back. And so having an updated, upgraded chemistry line will really help with flow and improved journey for our patients as they come through both our emergency departments and then of course through our ICUs as well.
Automating systems, making them highly reliable, reproducible, and efficient. So faster isn't always better, better is better.
Because our current line is 20 years old, we have a lot of downtime. We have maintenance, we have the service people in, from the vendor almost 3 times a week. It does affect our patients, it does affect our time to results, and it affects our, how our physicians can take care of our patients. The new automation line, being new and being more up to date, will certainly get the samples to the analyzers much quicker.
When you're dealing with a critically ill patient, such as Sara, that you're worried about their imminent threat to life, that 15 to 20 minutes is a huge impact, and so that's really important.
It's incredible to have a community that does support healthcare and to understand how important that is, that if we want the healthcare that is going to save us, the community has to step up. I had a 99% chance of not being here, and that does change you. I'm so grateful. Every morning when I wake up, it's a gift.
Thank you for all our donors who have been donating for years, and the amount of generosity that we've seen. Just can't thank you enough. The money from the donation takes us to the next level where we can provide absolutely the best care that we can.
There aren't words to describe it. When I came home and saw my daughter, unbelievable to know that I was holding her, and I just kept saying, "Mommy's okay." I just can't believe that I'm here and I get to experience life with her again. It's truly having a second chance. Those are the things that really matter.